Hudson Valley Community Services, which is a division of Cornerstone Family Healthcare. Welcome to International Overdose Awareness Day 2021. This is a day and an opportunity to remember those who we've lost to overdose, and to draw attention to the toll that substance abuse has taken in our Hudson Valley region, and to raise awareness for harm reduction techniques and to reduce stigma in our area. This event has been organised by Team Newburgh, the two divisions of Cornerstone Family Healthcare, which are Hudson Valley Community Services and the Centre for Recovery. Thanks to every one of our staff who has taken time to organise this event and to make it the best that it could possibly be. Thanks to our fellow service providers for being there and to share this experience with us. We're going to begin with a moment of silence in order to remember those we have lost to overdose and to send our thoughts and wishes to all those affected by substance abuse. Now I would like to introduce Christina Southwell of HVCS. She is the Syringe Exchange Programme Supervisor, and she's going to read a poem that was written by our Syringe Exchange Programme Coordinator, Frank Barone.
Hi everybody. So this is The Fentanyl Blues by Frankie Barone. The legality of substances is not in regards to safety, but to monetary gain. Greed is the worst drug of all, and it is to blame. Most doctors think we are junkies without feeling the pain. It is not fair. We should have a safe place to buy heroin and cocaine. Fentanyl contaminates many powders and individuals blind to its power. Hour after hour, waiting for him to answer, more important than a shower. I gave my life to this drug, heroin. I made it out alive. You can be safe while you use. You don't have to die. If heroin whispers in your ear, don't listen, it's a lie. Harm reduction programs are people that care. We just have education and clean works. Yeah, we'll share. Oh, and if you're having sex, here's a condom. Don't go bare. Unless you want to, I'm not here to judge.
Thank you, Christina, and thank you, Frank Barone, for penning that poem. Thank you. Now, I would like to introduce our first speaker. It is my honour to introduce our first speaker, New York State Senator of the 39th District, James Skoufis.
Thanks very much, Andy. And we had just met just a few moments ago, and I can probably speak for all of us. I can listen to Andy's voice all day, every day. Thank you for the introduction. And more importantly, thank you and your colleagues and partner organizations for bringing us together for this day of remembrance and this important day of highlighting the lives that were lost and, importantly, the work that endures. And so just to bring it home, provide a little bit of context, so I was told August 20th, 24-hour period right here in Orange County, we lost 10 residents to overdosing. Just here in Orange County, 24 hours. Nationally, last year, we hit a very sad high watermark of 93,000 lives lost in 2020. And it stands to reason, we as New Yorkers and Americans were cooped up in our homes. We were on lockdown, we weren't at work, we weren't around family, we weren't around friends. And for folks who are struggling with addiction, folks who are struggling with mental health issues, that kind of environment leads to a number like 93,000 lives lost, unfortunately. And so I'm privileged, it's my 9th year in the state legislature, privileged to work with people like Linda Muller and so many others who are on the front lines here in our community to provide support however I can through my office, whether it's legislation, the state budget. But I want to highlight one thing in particular that we did just a number of months ago that I do believe is a game changer when it comes to state policy and this tragic issue. And that is that in previous years, previous administration, whenever there were settlements through the Attorney General's office or other prosecutorial offices against or with drug companies and other bad actors, that money would often, usually, almost always, get swept into the general budget. $100 million against banks during the foreclosure crisis for the things they did, swept into the general budget and spent on a myriad of all kinds of unrelated things. So we passed a bill knowing that the Attorney General was nearing a settlement with some drug companies over their complicit role in these overdose fatalities. We passed legislation that requires that settlement money now to be put in a lockbox and used for addiction prevention and treatment. And so we have now $230 million in settlement money that was just announced a month or two ago that in past years would have been spent on completely unrelated things, almost to a penny. And now, once we negotiate a budget early next year, we all can rest assured that every penny of that $230 million is going to be spent on the issue that it ought to be spent on, and the reason why we have that money, and that is on addiction prevention and treatment. So, my parting words here are, I want to be a partner for as long as voters allow me to be a partner, and for as long as the incredible stakeholders here on the ground are doing the important work that is so necessary in saving lives. And so thank you for all that you do. Please continue to count me as a friend, and whatever you need, I'll be there in Albany and here locally. Thanks very much.
And now it gives me real pleasure to welcome Darcie Muller, Commissioner of the Orange County Department of Social Services.
For those of you who know me, it's the Department of Mental Health and Social Services. I just want to thank Senator Skoufis and his partners. Thank you so much for your advocacy and having that money go directly to the streets. It's so important for the reason we're here today. Linda Muller, and her team, which has been expanded to include so many of you here in this room today. She's an amazing leader and helped to bring us all together here today. So I thank you, Linda, for all of your work. For me, as a commissioner for the Orange County Department of Mental Health, you can imagine every day I get the opportunity to meet people who are struggling with addiction, who are in different phases of recovery, to meet their parents, the parents who are struggling watching their child change and become somebody other than who they were prior to addiction. To grieve the loss of their children, children who grieve the loss of their parents. My role in the Department of Social Services brings it home every day how many children are displaced from their families because their parents are struggling with addiction. You all know this because you're involved, that's why you're here, because you are ambassadors of the message about what addiction does and how it impacts the life. We are calling each other to action. We're holding one another accountable to continue to fight the fight, to not give up, to be there for those who are struggling. The Senator talked about what the pandemic has done for us here in Orange County. We lost, depending on the medical examiner's office, said 120 lives last year. ODMAP said 170 lives last year. After extensive work through our partnerships with each other and all of our other not-for-profits in the community, we had seen reductions in the number of fatalities. COVID sent us in the other direction. I will tell you this year, our numbers are reducing in fatalities. They're up in overdoses, but from January to August, we had 77 deaths, where last year we had 121 deaths. We have to keep doing the work. I just want to say to the Senator, The emergency alerts that go out, either from the hospital system or from the OD map, that'll let our community know that we've had a 5 overdoses or more within a 24-hour period. That's so you all know to reach out to your loved ones, to reach out to your clients, to send a message that we have something happening on the street, there's a bad batch, we have high numbers of overdoses. They aren't all fatalities, and that's an important note to make. So the 10 overdoses that happened on the 20th, they weren't all fatalities, but each of them could have been. And that's why we're all working so hard to expand our overdose response. I was just stopped at the Ulster table and excited to see those overdose response kits. We just ordered 200 Narcan cabinets here in Orange County. We'll be working with our community coalitions to have them spread throughout the county. For those of you who don't know what those are, they're just available on the street for somebody who needs Narcan. They can open it up and pull the Narcan kit out. It has instructions in there and use it to save a life, because our Narcan administrations are up this year too. So that is helping. We also have made the decision to purchase some fentanyl strips. We had some federal dollars that came through. You know, it's a little bit controversial, because if someone who's using substances needs to use a fentanyl strip, they're pretty expensive. They're not going to have 100 of them. So we know they're not perfect. We know they're not the only prevention effort we have out there, but it's one more that we're adding to the toolkit for our community. We've also added a rescue response for those who've survived an overdose, to work together with independent living and our partners in the system to have someone go out and meet with the person who has overdosed, if they're willing, to make a phone call, to bring a cup of coffee, to encourage them to begin their path to recovery. I can't say enough about, I have to mention Hope Not Handcuffs, because they, working together with District Attorney's Office and the police here in our county, have put together a pre-arrest practice. We didn't have a pre-arrest practice 5 years ago. We wouldn't have been here. We wouldn't have all these partners at the table talking about a pre-arrest, where police can make a decision not to arrest, to refer to Hope Not Handcuffs, so that they can engage them in treatment. That's coming a long way in changing the hearts and minds of the people that we work with to address addiction. I'm thankful for the change among our partners. We still have a ways to go. We talked about stigma reducing. These are some of the stigma reducing things that we need to do. So continuing to send those messages are so important. But one thing about Hope Not Handcuffs, there were 500 angels. Those angels are people who have struggled with addiction, who have loved ones struggled with addiction, who lost lives. And I'm thankful for everyone who's committed their hearts to this effort, and to each of you in what you do every day. So thank you for giving me the opportunity to join you today and to be part of this effort.
Now, it's a privilege and an honour to introduce our final speaker. Please welcome Linda Muller, President and CEO of Cornerstone Family.
First time I heard him speak, we kind of talked about Scotland and my love of whiskey that when I went through, so I could listen to him all day too. I'd first like to thank Senator Skoufis, a remarkable partner, but not to us, to the people that we serve, to your constituency that becomes first and foremost on every decision that you make. So thank you for everything that you do. And to Darcie, I couldn't have a better partner in both the behavioral health world as well as the substance use disorder service world. So thank you for your leadership, your vision, and all that you do. Thank you for being here. On April 1st, Hudson Valley Community Services became part of Cornerstone Family Healthcare, and that was an important time for our health center. It took the work that we did on primary care and specialty care, the work that we did in the methadone program, and coupled it with the outstanding services that are provided to the community for harms reduction, treatment, engagement, stigma reduction, and all of the pieces that you have done for years. You've closed the loop for our organization to create multiple entry ports for patients and clients to come get what they need in terms of services, where and when they need them. So I am grateful to be representing all of you. I am grateful for your service, and I just love the way your voice goes. So we're gonna make you master of ceremonies for everything. You know, today is a somber day. International Overdose Awareness Day is the world's largest event that works to do a couple of things. To end overdose, remember without stigma those who have died, and to share the grief of the family and friends who have lost someone. That's a tough thing to remember. Every one of us here probably knows someone, just one, someone, who was affected by drugs in one way, shape, or form. Many of you know someone who's died. I was just talking to one of my staff members who lost a nephew at 27 years old from an overdose. This is an opportunist drug that takes place in someone and becomes a chronic illness. This is not a choice. This is not a lifestyle. This is something that we as providers of care can treat, manage, and hopefully care for someone's entire life and help them to the road of recovery. I don't normally have notes, but I want to make sure that I get this right. For the services that Hudson Valley Community Services provides within our community. The first one is Project Reach Out, or PRO. This program works to facilitate the entry of people who use drugs into drug treatment services. They view this service as an important measure in reducing the population's risk of HIV, hepatitis C, and other infectious diseases. We forget about that when someone is injecting, if they don't have clean works. In January of 2021, PRO is now part of an needle exchange program. So Darcie, you said about controversy. Let me tell you, no one has ever died because of a controversy. They die because of the inability of all of us to address a controversy. So I couldn't be more proud that that is taking place to make people safe. We have a harms reduction program who are targeted at people of high risk for overdose and infection. The harms reduction program sets out to work with people who use drugs and are at risk to engage in behaviors that place them at the potential for overdose or the acquisition of a bloodborne disease. These are long-term drug-related harms reduction programs. They offer, when they're speaking with their clients, a judgment-free zone, meeting people where they are when they need services. Supportive one-on-one counseling, group counseling, medication management, treatment adherence, and Medicaid transportation. They also have what's called the HUB program, which helps people both in Orange and Sullivan counties reduce opioid use, overdose, and help to improve their general health by providing access to buprenorphine. It's another drug, different from methadone. Sometimes methadone gets a bad rap. It's unfortunate, but it is a drug that works and has worked for many people. But buprenorphine is also an alternative medication that can be used. This program works to connect clients to medical providers who can offer crisis visits, relapse prevention, and wound care. Why might you worry about wound care? Well, if you're injecting and you have an infection, you could lose an arm, which is very important that we make sure that everyone gets the care they need when they need it. Then the expanded syringe program, I can't tell you how important that is. When you have somebody who's not ready to be in treatment, would we rather them have an unsafe environment to inject whatever it is that they're using, or would we be better prepared to offer an environment where they would be safe? We have to get past our own stigma issues. We need to get past our own problems with what drug abuse looks like. Because it looks like me, it looks like you, it looks like every community and every person in every community, because it's an equal opportunity disease. It is a disease, treatable, gotta be comprehensive treatment. Many people who have use of illicit drugs has an underlying mental health issue. You've got to be able to treat both. So I am so proud to tell you that at Cornerstone, You can get that. You can get methadone, you can get buprenorphine, you can get all the harms reduction that these fine folks can provide you. They're on the street, they're doing their job. Couple that with primary care and with dental care services and behavioral health services, there's a place for everyone. This is a somber day. I acknowledge that. We took a moment of silence. But it's a day of hope, a day where we can look to each other. And I can say to all of you with a Hudson Valley Community Services badge on, job well done. We are better because of you. Our communities are safer because of you. You put yourselves on the front line every day for the people that you serve. You are doing God's work, and I thank you for that. I couldn't be any more proud to be participating here today. And if we could do one thing and walk away today, is to understand there is hope. There is hope in treatment when folks are ready. There is hope that life can continue past a diagnosis of a substance use disorder. There is hope for families. The engagement becomes the part that's important. And being able to bring a patient or a client in without judgment, without stigma, a place where people feel safe. That's what our jobs are. And all of us connected together can do just that. So thank you for being part of this. Let us never forget those who have died, the families that are there to pick up the pieces past that death, to remember that there is an opportunity to overcome overdose deaths, and there is a way to work together to give everyone a fighting chance. Thank you.
This concludes the press conference for the International Overdose Awareness Day. What I will say, I'd like to thank everybody for being here today. I'd like to thank Senator Skoufis, Darcie Muller, and Linda Muller for speaking so poignantly. Just a reminder, tonight there is a Facebook Live event that complements today, and I will read out the order that you can go and visit it. It will be on facebook.com/Hudson Valley Community Services, 6 o'clock until 6:30. And some of the people who will be involved aren't here today, but we should recognise and thank people like Team Newberg and others who are doing tireless work in our communities. People like Don Wilkin, who is doing fantastic work in Newberg. Thank you for coming. We are here until 4 o'clock. You can go to the table of remembrance. You can go and see other people for our services and take in what people have to offer at these facilities that we so generously give of ourselves to this issue. So thank you very much. I appreciate it. Have a great day.